My name is Dr. Salvatore Paolillo. I am a minimally invasive gynecologic surgeon, faculty with ETSU. Why did I want to become a doctor? Well, prior to coming into medicine, I worked in a field around medical professionals, and I saw how rewarding it was to help people. Apart from that, I saw that it was extremely engaging and constantly changing and rewarding in that sense, and that was really interesting for me. For me, I initially wanted to become some type of surgeon, but then I had my OB/GYN rotation, and I realized not only did I have an opportunity for surgery and specialization, but also for connecting with patients, and having those long-lasting connections really was something of value and interest for me. And then I subspecialized into minimally invasive gynecologic surgery, and that was interesting because I saw that patients had these different pathologies, things like endometriosis, chronic pelvic pain, fibroids, and PCOS, and helping them solve those problems that for them sometimes took years to figure out was really rewarding because I could really make a big change. One of the most rewarding parts of my job is sitting down with a patient for the very first time. When I sit down with them and talk to them about their problem, and they're kind of telling me how hard it is for them to live certain parts of their lives or dealing with a particular issue, and knowing the fact that I can make them better and improve their status from a low point to a high point with my medical skills is really rewarding. Some of my overarching goals for my patients are, one, to hear and listen to what they have to say. That is probably one of my biggest goals, of just letting them say what they want and explain their pathology and explain their situation to me. Secondarily, I would say that I want to provide and be a partner for them in their healthcare experience. I want them to know that they have options, that they're not just stuck doing it or feeling the way they currently are. And lastly, I really would like for them to know that and try to solve their problem. I am a surgeon, I love to operate, and I have the stamina to do so all day if I wanted. But apart from that is medical education, and that's something that I haven't actually had a chance to do much in my last job, but here, coming to ETSU, I am really excited to do that and provide that training. I was in awe of the doctors who trained me, and I am hoping to be that for the next generation of ETSU physicians. So I was raised by and surrounded by strong women growing up, and that really helped me, one, to respect women, and also to understand and understand how they articulate their needs. Apart from that, I have a lot of experience and have a passion for cooking. I always say if I wasn't a doctor, I'd probably be a chef. And so that's something I often connect with my patients with, where we talk about sharing recipes or talk about food in general, and that's another fun topic that I love talking to my patients about. Living here in East Tennessee and in Appalachia really is a special kind of place. You have these hills, these mountains, the dew on the grass in the morning. On your drive to work, you can see a cow or a horse, and that's something you don't get with city living. And it's something that does make you feel more connected to nature and the world around you. Hello, I'm Dr. Salvatore Paolillo. Thank you for spending some time with me, and thank you for choosing ETSU Health.